Hold on. It's backwards.
Yeah, you have to turn it around to face me.
Alright.
You gotta actually get me.
Can you see it?
Okay. Hi, my name is Jessica Larson. This is for Speech Class Communications 114, and we're going to discuss diabetes and how to manage and control your diabetes. To start off, we are educating a cat and some newly diagnosed patients with diabetes, and today's lesson is that we're going to demonstrate how to use an insulin pen, how to draw up insulin, and how to use a meter, and some of the side effects of insulin. Okay, so to start off, with giving insulin, with any other procedure, you want to always make sure you wash your hands first. So what you're going to do then is take your bottle of insulin, the vial. You want to take a alcohol wipe after you chop off the cap, wipe off the top, open up your insulin syringe, take off the cap, and push air in it to push out to make sure that your syringe is working appropriately. So let's say you need to give yourself 30 units of Humalog one night. You want to pull back air to 30 units, just like that. You're going to take that air, inject it into the top, push it in, and then draw it back on the vial. So you keep pulling back till you have your prescribed dose, pull it out, and you want to make sure that you tap all the air out to the top and then push back up to your designated amount, and then make sure that all air is out of the syringe. Okay? Now to inject this in yourself, you want to make sure you choose a different spot on your abdomen each time. Do not inject into your arms. You always want to do it in the abdomen. And every time you do it, it needs to be in a different spot so that you don't get what is called, hold on, I'll tell you what it's called.
Bruises.
Yeah, it bruises in lipodystrophy, which is your tissues not reacting well to the insulin. Okay? Then all you do is you grab a little bit of the subcutaneous tissue, wipe it off, and then you go ahead and inject yourself. I'm not going to actually inject myself. I'm going to put it right back in, and it's actually only just water. Okay, syringe anyway, so. Okay. Never recap your needle. Use a safety cap. Okay, I have a PowerPoint here, so we're going to kind of go through real fast. It's about controlling your life for diabetes. When you don't have an insulin needle, we also have insulin pens. I do not have one of those to demonstrate, but with an insulin pen, very similar, except instead of drawing up the insulin, starting in the pen, you just dial the number at the bottom. You wipe off the top with an alcohol wipe, put on the needle, and inject yourself the exact same way that I told you with the needle. Here's another copy of the needle. You have the cap, the needle part, the barrel, and the plunger. And another way of explaining it is to draw the air up into the syringe, insert into the bottle, and tap the syringe to make sure the bubble's out just reiterate. Some of the side effects of insulin: there's hypoglycemia, unconsciousness, the hypodystrophy, and hypokalemia. Insulin, what it does is it pulls calcium into your cells, which causes the hypokalemia. If you don't eat and you take too much insulin, that can cause you to become very diaphoretic, which is sweating, lose consciousness, and pass out. So it's very important that you're monitoring your blood sugar while you're also on insulin. Monitoring your blood sugar, that's really up to your doctor. Your doctor should specify how often he wants you to take it and how often insulin he wants you to take and how much he wants you to take. Okay? Some signs and symptoms we kind of already talked about. Taking the blood sugar is very important. Make sure you're cleaning your hands. Once again, wash your hands before you check your blood sugar. There are very many different kinds of machines out there, so I don't have a machine with me. Whatever kind of machine you have, either ask your doctor or the pharmacist, wherever you bought it from, and they'll instruct you how to use it. This is a regular lancet that you use, and really all you have to do is wipe off your fingers with an alcohol wipe. Wait till that alcohol is completely dry, because if alcohol is not completely dry, it can alter the results of your blood sugar, and then take the lancet on the side. I'm not going to poke myself, but just poke yourself and draw out the blood, and go ahead and throw it on the meter. So here is a picture of one of the meters. Here's a picture of the lancet. And then last but not least, metabolic syndrome, which is one of the factors that goes into diagnosing. It increases the risk of diagnosing diabetes. It is when your triglycerides are over 150, your blood pressure is over 130/85, your HDL cholesterol, which is the good cholesterol in your system, is below 40, and your central obesity is 35 centimeters around the waist for women and 40 for men. So when you have 2 or more of these items, you're much higher risk for obtaining diabetes. Okay. So to do one quick picture around, so everybody's still here, and we even have a puppy that's attacking us.
All right. Super.
Okay, I hope everybody enjoyed my speech, and I look forward to reading or watching your speeches as well. Thank you guys. Have a great day. Bye.
Thank you.
Thank you.
Thank you.
Thank you.
Oh my.